FEM Health podcast where we talk about women's health from a modern perspective. Today, I have Dr. Stephen Fein with me, and we're going to go behind the scenes on an issue that affects one third of all women throughout the world. So, before we get started, do you mind introducing yourself?
I'm Stephen Fein. I'm a hematologist originally from Miami, and I trained at Johns Hopkins and at Duke and returned to Miami to become a women's health specialized hematologist.
And how long have you been at this?
I've been at it for 20 years since I started in medical practice. In the past 5 years, I transitioned to doing telemedicine-based hematology focused on women's health.
Okay, interesting. So, when you say, so the 20 years, were you private practice? Were you in the hospital?
Originally, I started as a hematologist specialized in leukemia and blood cancers, and I realized that a major need was hematologists who were focused more on what's called benign hematology, which is mostly women's health hematology.
Okay. And you said 5 years you transitioned over. What inspired that major change?
Yeah, a lot of transition. It mostly happened during the pandemic when people became more willing to use telemedicine as a
Mm-hmm.
way to see doctors. And at first, it was obligatory when we were all in trouble with COVID. In these past 5 years, telemedicine has still been very easy for people and increasingly popular among women who need this kind of service, particularly working women who would find it easier to see a doctor at night or on a weekend instead
Mm-hmm.
of taking time out during the day and leaving her work or leaving her family to see a doctor.
Okay, interesting. So I noticed your shirt. It says the original Iron Man. So what's up with the iron?
What's the story?
What's the story with the iron?
We figured out that early on that the major need for women's health was to find women who need iron and to plan iron infusions for women.
Mm.
So we've gone on a mission to raise awareness about this and to help identify all women who need iron and women who commonly women have low iron. Iron deficiency is very common. Women who need iron feel so much better after they receive an iron infusion. So we've decided that we're going to try to convince people that it's that the women are the ones who need to become the Iron Man, the original Iron Man.
So I guess my question is why iron? What's so important about iron in the perspective of women's health?
People commonly think iron is just another mineral or like kind of like a vitamin, but it's not. Iron is critical for every cell in the body to use energy. And it's every cell in the body. Your muscles need iron to contract, your brain needs iron to think, a baby needs iron to develop. It turns out that iron is by far the most important mineral or substance that a person needs to be able to function.
Interesting. Well, I guess my next question is I know a lot of people personally that do have iron deficiency, and I think that's something that's very common among women. You see it in social media, you see it in conversation, even if you're just chatting with people, catching up with friends, some may be iron deficient. So I mean, it seems like it's a pretty livable thing to have, but why do you disagree?
One of the problems with iron deficiency is that you kind of get used to just being tired and living with iron deficiency and not appreciating how much better you could feel and function if your iron were improved and increased to normal levels. And what's happened is that because 1/3 of all women have low iron, it's become normalized. It's just widely accepted that women are allowed to live with low iron, or it's understood that it's just normal for women to live with low iron, commonly associated with having heavy menstrual periods.
Hmm.
So women are just supposed to live with that combination. The important problem from my perspective is that women also have pregnancies with low iron, and their babies have the risk of being impaired by not receiving enough iron during development. That to me is the top priority. A secondary and maybe equally important priority is that women ought not have to live tired.
Right.
And women are deprived of their ability to have a better quality of life, perform better at work, receive the job promotion or salary that they're entitled to. Teenage girls not able to get the grades and scores that they're supposed to get because they're not able to think as well because their iron is low. So I view this as a gender inequality problem that can be solved so easily by identifying everybody who needs iron and planning iron treatments.
Hmm. And what about long-term side effects? Let's say women do choose to live with low iron. Are there any long-term detrimental side effects?
It's a big question. The biggest thing I can tell you is that babies born to iron deficient mothers have a risk of being impaired, including having ADHD, autism, impaired intelligence. and postpartum depression in the mother. So long-term effects of that are easy to imagine.
Hmm.
The long-term effect of a person who's living herself with low iron, we imagine that she has damage to all her organs, but that kind of thing hasn't been proven because it would take years to do that kind of study to prove.
Right.
I wonder if people actually live a shorter life if their iron is deficient, but it hasn't been proven.
Okay, interesting. So you said that you do iron infusions as well. So how did that start? Was it just telemedicine first? Was it all together? How did that come to be?
It's an incredible story. I trained as a hematologist who specializes in cancer, and it turns out that cancer specialists also do iron treatments. And I realized early on that women who don't have cancer really have no reason to want to see a cancer specialist to get iron. It has to be separated. So I started telemedicine to see women and talk to them and figure out how to plan an iron treatment for those who need it. And early on, myself and my team, we realized that we would have to do the iron infusions ourselves to make this work.
Hmm.
We created iron infusion centers. We're the FEM Iron Infusion Center team, and we made it possible, going through many hoops and figuring this out, to get iron infusions set up for women very quickly, usually within a week of meeting somebody. And that's
Mm.
something nobody had ever accomplished
Yeah,
before.
that's very efficient. I feel like for treatments like that, you usually have to go to the hospital and things like that. Am I wrong?
Well, that's another point. So there are three places in the world to get iron infusions:
Okay.
either a cancer specialty team,
Hmm.
or a hospital, or an independent infusion center, which is we're now independent infusion centers that are like some other independent infusion centers that can do iron, but there are other ones that are not as focused on the iron.
Okay, interesting. So, are iron infusions the best treatment? Because I've heard people take iron pills, and I think iron pills are pretty common. They're OTC. I know most women have it in their daily vitamin regimen. So, what's the difference between iron pills and
Yeah,
an
the first
infusion?
question I'm asked when I tell somebody they need iron is, what about the pills? What about my diet? Can I have more meat? The answer is, by the time you've come to me with iron deficiency, chances are that your diet has been inadequate. Even
Hmm.
if you tried to eat extra meat or extra foods, other foods besides meat that have iron, spinach, it's inadequate. And part of it is that some people just don't absorb iron that well compared to others. Now, the pills are better than nothing. The problem with the pills is that many women don't feel good when they take the pills, so they don't like the way they feel. They feel queasy or commonly get constipated.
Hmm.
And even if you take the pills every day, or sometimes you hear taking it every 2 days, it turns out that the pills don't work that well. Part of the reason is that we know your body can only absorb about 5 milligrams a day, no matter how much you take. And by the time you come to me with low iron, your deficit could be 1,000 milligrams.
Oh, wow.
Imagine it could be 6 months worth of pills, assuming that you took it every day and assuming that you didn't have ongoing iron loss like
Right.
women who have heavy menstrual bleeding.
Oh, okay. And I guess why is this not as normalized? Why do you think people aren't as aware that this is something that can happen and it's something so detrimental?
One of the reasons that this is still a problem that's not well appreciated is that many doctors trained in the era where it wasn't as well understood or as well talked about, and only these past 10 years has it been really easy to treat. So
Hmm.
it's a modern era hematology problem that's just now being appreciated more. A lot of pregnant women in the past were told to take iron pills, and prenatal vitamins have iron. And at one point, it wasn't thought to be safe for pregnant women to take iron infusions, or maybe only those who were most desperate, the lowest.
Hmm.
And now many, including ourselves, we've proven how very safe it is to do for pregnant women. So it's really a modern thing that's becoming increasingly accepted.
And do you think that's just in the US? Do you think that's worldwide? Do you think it's more of a
Yeah, in the
cultural?
United States, it's still in its early stages, whereas in many other countries, especially in all over Europe, it's widely accepted that women have low iron, and general practitioner type doctors prescribe it all the time. You can walk into an iron infusion center and pay very little compared to the United States,
Hmm.
and get an iron infusion without a lot of effort in almost every European country.
Okay, and you're doing a lot of work to try to change this. I mean, I know you do research. And do you think that the reason doctors in the US don't know is because of the guidelines that have been placed, or do you think it's something a little more on the surface, like just lack of knowledge?
Yeah, it's a combination of a bunch of things. One is that there's low incentive to want to give iron infusions because the doctors who do infusions, like cancer specialists, it's a challenge for them to actually do iron infusions because of sometimes there's a concern about whether there's a risk to it. and there's not a lot of incentive for, like, they don't get paid well to do it.
Hmm.
So there's been a lack of interest in actually doing the infusions. And in the United States, um, there's just less talk about it and less understanding of the importance. The doctors haven't been trained well to do this, whereas maybe they've been trained differently in other countries and hear more about it. So it's just a different, I would say, culture.
Okay. So let's say I'm a woman. So basically, you're telling me that if I'm a woman with either heavy periods or I'm pregnant, I should be checking my iron no
Yeah.
matter what.
Every woman who has menstrual bleeding has a risk of having low iron just for that reason. Women also have a risk because some women don't absorb iron as well as others, especially those who have inflammatory or autoimmune conditions,
Hmm.
and women who've had weight loss surgery like gastric sleeve surgery. A lot of women, many millions of women in this country, many more women than men, and that affects your iron absorption. So every one of those people, including every woman who has menstrual periods,
Hmm.
needs an iron test. Now, the iron test is different than the thing called the hemoglobin test.
I was about to ask that.
It has to be done separately, and people just don't realize it. And doctors oftentimes don't think that you need an iron test unless you already know that your hemoglobin's low. So
So you
these,
can have low iron but not have a low
yeah,
hemoglobin?
yeah, you
Okay.
have iron deficiency without anemia, and it matters
Okay.
just as much.
Okay.
So all of this, and so women need testing every year or two. And it turns out the international OBGYN guidelines
Hmm.
have stated this for the whole world, but the American OBGYN groups haven't embraced it yet.
Oh, okay. And earlier you said something about teenage girls and menopause. Are they also a very high
Yeah,
percentage for iron deficiency?
I focus a lot on women who have heavy menstrual bleeding or any menstrual bleeding and a
Hmm.
lot on pregnancy. But two other major groups need iron testing and treatment. So, teenage girls are known to have a high risk of getting iron deficient, even if they don't have heavy menstrual bleeding. It turns
Hmm.
out that a third of teenage girls, we now know age 12 to 21, in big studies, a third of them have low iron. Some of them are tired, impaired, can't function as well in school, can't do athletics as well. So it's a major problem among teenage girls. And it's challenging to convince teenage girls and their parents that they need this testing unless they're very, very tired and uncomfortable.
And what about menopause?
The menopause woman, for reasons that we don't totally understand, as you approach menopause in the perimenopause or premenopause time, iron deficiency becomes increasingly common, even without having heavy menstrual bleeding. Many women, as they approach menopause, actually get heavier menstrual bleeding, so that would be another reason for it.
Oh, okay, so it is overall just it's if you're losing blood, regardless of the age you're at, whether it's the baby or it's you need to be checking your iron.
All women who have menstrual periods, we now know that 30% of all women under 50 have iron deficiency, about a third of all teenagers. And of course, every pregnant woman who is intending to give 1,000 milligrams worth of her iron to a baby,
Hmm.
if she doesn't start with 1,000 milligrams, then the baby and she will be deprived.
So what are just as a PSA, what are like the telltale symptoms to watch for when you are iron deficient or maybe your iron is dropping a little bit?
When you get iron deficient, you get tired, you don't feel right, you feel a little short-winded when you do exertion or go upstairs. Sometimes you get sleepy during the day, unexplained sleepiness. You get what's called brain fog.
Okay.
You have impaired memory, mood, and concentration. You get irritable. Women tell me this all the time. And I am just so confident that by treating them, they're going to have improved quality of life with less fatigue, less sleepiness, and better ability to functioning at work, not missing work as much, able to do better at work, better at
Hmm.
school for teenagers.
Okay.
Some women end up having unusual problems, like a weird thing that happens that you have ice craving or ice chewing. These
And
are
why
people,
why ice? Why do you think
yeah,
that
it's a
is?
weird
That's
thing.
weird.
The term pica, it means that you crave food that's not really food. You crave things that are not food. And ice, although it's edible, um, it's a craving for ice that women commonly share with me. These are people who have the most severe cases.
And
In
are there any physical symptoms that women maybe can look out for
uh, but besides the ice craving,
besides the ice
yeah,
cream? Yeah.
yeah. Oddly, women have this thing called restless leg syndrome. It happens a
Okay.
lot that you're at night trying to sleep and your legs are just uncomfortable and crampy legs.
Mm-hmm.
I presume it has to do with your muscles that are starved for iron that are not able to be relaxed.
Right.
And then another thing that happens is that women who have hair shedding or hair falling out more than expected, we commonly see that iron's related. And when you ask a dermatologist about the hair or a neurologist about the restless legs,
Hmm.
they'll say that they think those women need higher iron levels than everybody else to overcome those symptoms.
Wow. So I mean, basically, it seems like the iron infusions are the best way to go if you are going through something like that.
Mostly, if for no other reason, that it can be solved quickly and easily with an
Right.
iron infusion. Whereas if you take iron pills, assuming that you can take them and that they work, it could take months to see a difference,
Yeah. And given that you're not losing any
assuming you're
more.
not even losing iron.
Right. Okay. Well, if you could say one thing to all the women out there that are watching and listening, what would you say to them?
Get a ferritin test.
Okay. Well,
And I'll say one more. So it's important that all women are tested every year or two. All women, and after menopause, all women need testing every so often. Important that all pregnant women get tested, especially around or by the time of the beginning of the third trimester.
and they demand an iron panel.
What you have to ask for is the ferritin test.
Okay.
It turns out that usually the ferritin is the easiest test to interpret. Sometimes we do expanded testing and do what's called the iron panel.
Mm-hmm.
A ferritin test is so easy and so inexpensive, and now you don't even need a doctor to order it. You can order it yourself online.
Oh, really? And how do you do that?
Yeah. You can go to the lab companies. You can go to
Okay.
quest.com and order it yourself. Nowadays, there's also some third-party people who sell the iron orders. You can go to what's called Jason Health, like the name Jason,
Mm-hmm.
jasonhealth.com. You can order an iron test. It costs about $20. You don't need a doctor.
Yeah, I think once I did ask for my iron and my doctor told me that my hemoglobin was normal so that there was no need to order an iron exam.
This is a situation where you have to take charge of your own health. And
Right.
even if the doctors don't agree with you about the testing, I'm here to tell you that you need iron testing every year or two as a woman.
Okay. Well, thank you so much for joining us. Do you have anything else you would like to say?
Thank you for having me here and for teaching everybody about the importance of iron testing and treatment.
Well, thank you. And we'll see you all next week.